Addressing the growing link between obesity and cancer requires more than individual lifestyle changes. It demands a systemic shift in policy that alters the environments in which people live, eat, and move. The rise in obesity-driven cancers is not merely a reflection of personal behavior, but a direct consequence of decades of policy failure, corporate influence, and public health neglect. While evidence-backed policy interventions exist, their implementation has been slow, fragmented, and often obstructed by vested interests. Without bold and coordinated action, the burden of obesity-related cancer will continue to rise, disproportionately affecting the most vulnerable populations. One of the most frequently proposed interventions is the taxation of sugar-sweetened beverages. Soda taxes, implemented in places like Mexico, Berkeley, and the UK, have shown real potential to reduce consumption of high-calorie drinks, major contributors to obesity and metabolic disease. These taxes also generate revenue that can be reinvested in public health initiatives, including nutrition education and subsidized physical activity programs. However, attempts to pass soda taxes often meet fierce opposition from the beverage industry, which lobbies heavily against such measures and frames them as regressive or anti-consumer. These arguments distract from the overwhelming evidence that sugary drinks contribute nothing to nutrition and everything to disease. Another key strategy involves increasing access to healthy foods in underserved communities. Food deserts, areas without affordable, fresh food, are breeding grounds for obesity and chronic illness. Policies that support mobile markets, urban agriculture, and incentives for grocery stores to open in low-income neighborhoods can help shift the default food options. Yet such initiatives are rarely scaled, often underfunded, and treated as community experiments rather than essential infrastructure. Without long-term commitment and investment, food equity remains out of reach, and with it, any hope of lowering cancer risks tied to poor diets. Subsidies for healthy food could provide another solution. Currently, U.S. agricultural policy heavily favors commodity crops like corn and soy, used largely in processed foods and animal feed, while fruits and vegetables receive minimal support. This imbalance keeps unhealthy food artificially cheap and healthy options relatively expensive. Redirecting subsidies toward whole foods and sustainable farming could help realign the economic incentives behind dietary choices. But again, such proposals threaten entrenched interests in the food industry and face substantial political resistance. Improving community access to physical activity is also essential. Obesity prevention is not just about diet, it's about movement, too. Communities need safe parks, walking trails, and recreational centers, especially in areas where physical inactivity is prevalent. Programs that promote fitness at the neighborhood level, such as free exercise classes or after-school sports, have shown promise, particularly among youth. Still, these efforts are often sporadic, tied to short-term grants, or cut during budget crises. Long-term investment in physical infrastructure and active living environments is critical if these programs are to have any lasting impact. Public education campaigns, while important, are insufficient on their own unless they are paired with changes in policy and infrastructure. The failure of past campaigns often lies not in their messaging, but in their isolation. They told people what to do without giving them the means or environment to do it. Moreover, these efforts rarely reflect the cultural or socioeconomic realities of the populations most at risk. For policies to be effective, they must be designed with community input, adapted to local contexts, and delivered with cultural humility. Otherwise, they risk becoming one more top-down directive that fails to change behavior or build trust. Ultimately, the challenge of reducing obesity-driven cancer is not technological or even financial, it is political. It requires confronting powerful industries, rewriting outdated subsidies, and investing in public goods that do not turn immediate profit. These are hard decisions, but the cost of inaction is already visible in rising cancer deaths, overwhelmed health systems, and growing health disparities. Incrementalism will not reverse an epidemic that has taken root over generations. Only bold, structural reform can begin to undo the damage and prevent a new generation from facing the same preventable fate.